Imagine being born with a disfiguring disability in a poor village in a third world country or other disadvantaged area. Then imagine being the parent of such a child, and you know that you have no money to help your child, whether that be to get a corrective surgery or provide speech therapy or whatever it is that they need. You know that you have no way to do this. And you realize that your child will face a life of ridicule and disadvantage because of this. I'm Jenny Adler. This is speech number 2. It's an informative speech for National University, Speech 103 with Professor Juhos. I decided on the Fresh Start Surgical Gifts topic because I have volunteered for this organization in the past, and they do important work, in my opinion, to help disadvantaged children. I work as a surgical technologist, so when I volunteer for them, it's basically just like going to work, except I'm doing it for free, which seems like a pretty easy way to give back. Fresh Start Surgical Gifts is an organization that provides needed surgeries to infants, children, and teens that have physical deformities that are caused by birth defects, accidents, abuse, or disease and neglect. And it consists of a rotating group of volunteers who conduct weekend surgical clinics to do reconstructive surgery on children. They also have dental clinics for children who require ongoing dental treatments. Now, Fresh Start hosts 6 to 7 surgery weekends per year. They have doctors and other healthcare professionals that donate their expertise to help more than 400 children every year. The patients come from Mexico, the United States, Central America, and many other countries around the world. All that really matters is that there are a child who needs help, and they can't pay for it. So that's what they're there for. The treatments are done at Rady's Children's Hospital in San Diego. Now, since they began in 1991, Fresh Start has provided over $29.9 million worth of free medical services. Fresh Start is able to provide these surgical gifts through donations of money, medical supplies, but most importantly, people's time. They staff their operating rooms with volunteer surgeons, anesthesiologists, registered nurses, and surgical technicians. There are also volunteer pre- and post-operative nurses and ancillary volunteers who don't need to have medical experience, but they help with driving, housing, and supporting the children's families. Each surgery weekend will consist of 9 to 12 major surgeries, speech therapy sessions, consults with new patients, consults with old patients who are coming back, minor treatments, and post-operative appointments. Most Fresh Start patients require many follow-up visits for years to come. For example, a cleft palate patient needs an average of 7 years of dental care and other procedures after their original surgery. This is to provide them with the best possible outcome. Fresh Start treats many different conditions. Some of the most common are microodea, which is a deformity of the ear, hemangioma, which is a bright red nodule that consists of extra blood vessels in the skin, which it's disfiguring and the child can be made fun of. It has no real physical implications. They also treat neurofibromatosis, which is a genetic disorder of the nervous system that results in the growth of disfiguring tumors all over the body. They treat hairy nevus, which actually I did last time I volunteered, which is a giant mole that covers a large portion of the child's body and it's hairy. They treat cleft lip and palate problems, which it consists of openings or slits in the upper lip and the roof of the mouth, in which the child can't get proper nutrition because of their inability to suck and or eat and get proper food. They treat Treater-Collins syndrome, which affects the bones of the face. They treat port wine stains, which I think most people are familiar with, the deep purple mark that often takes up a large portion of a child's face, and hemifacial microsomia, which is basically when the lower jaw is deformed. I think I would just walk you through an average day when you volunteer at Fresh Start. What you do is you show up to surgery, just like you do if you work in a hospital. You start about 6:30 a.m. You change into surgical scrubs. You go to the front board. You get your assignments. You go to your room. You collect your supplies. Consult the patient's chart. Meet with the doctors. Figure out what your plan for the day is going to be. Then once you start your surgery, it may last anywhere from 1 hour to 5 or 6 hours. And when this is done, the child goes to postoperative care and on to an ongoing care facility after that, where he'll be reunited with his parents. Fresh Start is an organization that is working to help severely disfigured children from around the world. And I'm glad that I was able to give everyone a little bit information on what they do and how people can help. Anyway, thank you for giving me the opportunity to tell you all about it. Goodbye.